You are listening to Thrival Nutrition Podcast, Episode 2.
Thanks for tuning in to the Thrival Nutrition Podcast with Lahana Vigliano, where she teaches you how to take back your health with real food. Lahana is a holistic nutritionist that holds a degree in nutrition science, and she studies sports nutrition through the International Society of Sports Nutrition. Lahana founded Thrival Nutrition to share her expertise through podcasts, webinars, group plans, ebooks, one-on-one coaching, and more. Here is your host, Lahana Vigliano.
Hey guys, I am so excited to share with you today's episode with an HPV researcher from Mount Sinai Hospital in New York. When Amira and I met, we totally hit it off because we both went to school for nutrition and have similar passions. I love talking with other professionals with the same mindset because we just learn so much from each other. So I hope you guys enjoyed today's episode. It's filled with goodies. If you haven't already been to my website to download your free copy of my ebook, How to Shop Healthy on a Budget, go ahead and jump over there and get your copy. In it is a full shopping list of real food and tips and tricks on how to shop on a budget. So go grab it at www.thrivalnutrition.com. The link is in the show notes. Okay guys, let's go over and chat with Amira. Hi Amira, how are you?
Hi Lahana, I'm doing well. I'm excited to talk about HPV with you today.
I am so excited. I know we have so much to cover, so let's just jump right in.
Awesome.
Let our listeners know who you are and what you do.
Great. So my name is Amira Al-Bahiri. I have my bachelor's in science and food science and human nutrition, and I work at the Mount Sinai Adolescent Health Center in New York City. And the center is an all-inclusive healthcare center for people between the ages of 10 and 22. So every year we serve about 11,000 youth in New York City and greater New York City area. And we provide mental health services, social work, nutrition services. We have a registered dietitian there. Then we just have our basic primary care doctors. But a lot of the times the main issues we're addressing are related to sexual health because we are a free and confidential clinic. Patients can come into the clinic without their parents and then get important sexual health that they need that maybe they wouldn't otherwise be able to get.
Wow, that's awesome. It's really good to have those connections, especially if you're an adolescent. And I know how nerve-wracking that is to talk to your parents about certain things. So it's awesome that there's a safe place for people to go to.
Yeah. It's really great.
Before we talk about what you do currently, I just want to say that I love your passion for health in low-income communities, especially for kids and young adults. What are some things do you think that we can help our local low-income communities to improve their health?
Definitely. That's a great question. I think it is really important. I believe in volunteering a lot. I think it's really great when you can just go out in your community and help in any way that you can. I definitely believe in mentoring. I've especially seen the value of that. My sister is in a mentoring program, and we actually just started one at the center too. I think it is important for a lot of youth to have a mentor that isn't necessarily their guardian or their parent, but an adult that can kind of talk to them about school and maybe things like sex, like more sensitive topics that maybe they can't talk to other people about. So I think mentoring is really valuable. So things like Big Brother, Big Sister, like Boys and Girls Club, things like that. I think those are really good organizations and ways to reach out to youth in lower income or low resource communities.
That's awesome. I did Big Brother, Big Sister program before.
That's awesome.
It was really great. It was a great experience, and I enjoyed doing it. And it was a little nerve-wracking, even for me. On the other side, I can only imagine what it was like for her. But I knew that when I was hanging out with her and just giving her advice, I felt that it helped her a ton. And so I definitely love that program.
Yeah, definitely. It's so helpful.
I know you heard my podcast last week and you were totally interested in the chemical stressor side. Can you go into us a little bit about the chemical stressors in adolescence?
Definitely. So this was really fascinating to me. We had a doctor come in and talk to us. His name's Dr. Kenneth Ginsberg, and he was talking about chemical stressors in adolescents who have been abused or neglected. And basically, as you're growing up and you have all these stressful situations that happen to you, abuse being an example of that. And that could be emotional or physical. It doesn't necessarily have to be physical. And then that releases cortisol into your system. And as a developing person, that can really affect a lot of your different systems, including the immune system. So when we're talking about like HPV, for example, today, and immunity and how to fight off HPV infection, I think it's important to take that into consideration when thinking about low-income communities, because a lot of the times these youth haven't really gotten the best start with their health because of things that are really out of their control. So we do have to consider that when treating, talking to them about these things, and hopefully giving them the best care we can.
Yeah, absolutely. I think it's so important to be involved with our local communities. And I want to encourage my listeners to reach out to their communities and volunteer or work in areas where help is needed most.
Definitely.
So let's switch over to what you do for a career as an HPV researcher. Can you give us just a basic overview of what HPV is?
Sure. So HPV stands for the human papillomavirus. It's one of the most common sexually transmitted infections, or STIs, in the United States. So a lot of people don't really know that, and a lot of, especially the patients that I talk to every day, I've never heard of HPV, didn't even learn about it in school, but it is so common, and about 75% of sexually active people will have HPV at some point. So it's extremely common, and it affects a lot of people. Basically, HPV can cause two major things. It can either cause genital warts, and I'm talking only about the sexually transmitted strains. So there's other strains that can cause non-sexually transmitted things, but in sexually transmitted HPV, it can cause genital warts in men and women. It can cause cervical cancer, vaginal, vulvar cancer in women, and also anal and oropharyngeal, or throat cancers in men and women. So we are concerned about it in that sense. HPV causes most cases of cervical cancer in the United States. So we should be looking out for it.
If someone had one of these pre-cancer strains, is this like a death sentence? What does this mean?
Yeah, so that's something that comes up a lot. So a lot of the times we'll see a patient and they could find out that they, had an abnormal pap smear that day. So, and they're pretty upset about it. They're worried. But most of the time, what you have to do is you just have to monitor it. And a lot of the times when you do monitor it, that's when you can prevent it from getting worse. A person's coming in and really just being aware that they do have maybe some abnormal results. And when it does become really dangerous and when it could lead to a death, hopefully that wouldn't happen, is when it goes unnoticed. So it goes unnoticed, it goes untreated. People don't get a colposcopy, stuff like that. So that's when it could really become dangerous. But as long as you're monitoring your health, then hopefully it won't turn into something that is life-threatening.
Yeah, I totally agree with just kind of knowing what's going on in your body, whether it's yearly blood work, yearly pap smears, things like that. I just love knowing what's going on. Am I deficient in anything, or is there something I should be worried about? So I love that. And the pap smear doesn't have any questionable things like mammograms do, with the radiation. Pap smears are totally safe, and it's great to know what's going on, because we obviously can't see what's going on inside.
Yeah, for sure.
So I know that both men and women have it. Obviously, the women do the pap smears, but what about men? What do they do? How do they know?
As of recently, there have been increases to try and create a test for men to get tested for HPV. Personally, in our study, we do test men for HPV because we have a women's and a men's study. But the way we do the men's test isn't a clinically approved test. It's only for the study, but it can be done. So basically what we do is we do a swab of the genital area and the anal area, and they also do a oral rinse, kind of just like mouthwash. And we send that to our lab at Albert Einstein College, and they do the testing. Basically, they're just typing what kind of HPV might be present in those tests. But as far as a clinical test, there is no clinically approved test for men. So a man can't just walk into a clinic and be I want to get tested for HPV, which is really unfortunate for them and their partners. Hopefully in the future we will see a new test for men.
Yeah, absolutely. Is men have an increase in anything like women do? They don't have cervixes, but do they have any type of increase of cancers if they have HPV, or do they just pass it?
Oh, yeah. So that's a great question. So men definitely can get cancer from HPV. cancer of the penis, they can get anal cancer, and again, the oropharyngeal or throat cancer. So they aren't just carriers of the virus. Before, it was thought that they were just carriers and they would just pass on the cervical cancer strain to women. They actually can also get cancer from HPV and also get genital warts. So in a genital warts case, if a man were to go to a doctor, obviously they could get treatment for the warts, but that doesn't mean that they're getting treatment for the HPV.
Wow, that's interesting. So it's like putting somewhat of a Band-Aid on it because it's not trying to fix, help your body with actual virus, just the warts that
Exactly.
it gives.
Yeah. Yeah, exactly. And genital warts are very, very infectious and very inconvenient, but they're not going to like harm your body in the way that a cancer could. So
yeah, and those are just the different strains within HPV because I know there's a ton of different strains.
Right. There's so many. I think there's like over 100 strains of HPV, and I think about 40 of them are sexually transmitted.
Wow. What are the other ones transmitted by?
So most of them are transmitted just through skin contact. So that's why it's so common, is because even if someone's wearing protection, like a condom or a dental dam, they could still be passing it because there's still going to be like skin exposure there. Like I joke with my patients sometimes and I'll be like, unless you're wrapping yourself with saran wrap before you have sex, like it's really hard to avoid transmission of HPV just because it's transmitted just from skin touching.
Wow, interesting.
Yeah. Mm-hmm.
That's so funny, saran wrap.
Yeah. Yeah, they always laugh at that one.
I see you went to the University of Florida for nutrition, which I think is awesome.
Yeah, okay.
Providing the right nutrition is so important and one of the most powerful things you can do for your body. What you fuel yourself with is what gives you a strong immune system and what is keeping our cells healthy and just a strong body. Can you see a link in nutrition helping with someone with HPV?
Definitely. So just based on your philosophy, and I also share it as well, eating right can just do wonders for your body, and that definitely applicable to your immune system too. So I was looking at a lot of papers today, just looking over HPV and linked to nutrition, and I actually did find a great one that was conducted in Brazil, and it was women who were already testing positively for HPV, and they tracked their food for several years and found out that there was an association. And just to say, like, this is not like proof, but they did find an association that when they had like carotenoids in their diet, which, can produce more like vitamin A, and then also vitamin C, that they had a lower risk of getting persistent HPV infections. So meaning like they would come back and test positively for the same strain again and again. So hopefully there will be like more studies done that are looking at HPV related to diet. But overall, just looking at immunity related to diet, there's so many studies on that. And we found a lot of minerals and vitamins that help your immune system. And it's so important to have a balanced diet that contains all these vitamins and minerals so that, you can function as best as you can.
What do you think are some of the top foods we could eat to help support our immune system?
Obviously, vegetables and fruits is such like a broad statement. As far as HPV, so I was looking at foods like high in carotenoids, and a good thing for people when they're just going to the grocery store and you're in your produce section is to look at colorful foods. So carotenoids are just what gives fruits and vegetables their pigment. So like red peppers, green peppers, yellow peppers, carrots, all these things are containing precursors to vitamin A. So then when you eat them, then you're producing vitamin A in your body. And then definitely there's been so many studies on zinc and vitamin C, selenium. Interestingly, in this study, they found that patients that ate papaya regularly also had less HPV persistent infection, which I thought was pretty cool because it was done in Brazil. So, papaya is something like they eat a lot.
That's awesome. Pretty sure papaya is definitely one of the genetically modified foods here in the U.S. So finding a good organic papaya is super important. I'm sure they don't have that problem in Brazil like here. About supplements, just like vitamin C supplement or a vitamin D supplement, what do you think about those for supporting the immune system?
That's a great question. I go back and forth with supplementation. I think from research and stuff, they say a lot of times you can over supplement to the point where either you could do harm to your body or won't create any additional benefits. So really just kind of like wasting your money. So I think it's important to first of all get yourself a balanced diet, and try and get those vitamins from your food because, from the food is more bioavailable than from supplements. But also, like, for vitamin D, like you mentioned, if you are living in the Northeast, like right now, and you never see the sunshine, and maybe you're not eating foods high in vitamin D, then maybe, yeah, you would want to get a supplement.
Yeah, for sure, because everyone up north, I definitely recommend using a vitamin D supplement because you're right. They don't see the sun. They're not getting like what us Floridians are used to.
Yeah.
But I definitely agree that food is just a machine in itself. There's so many like phytochemicals and everything that work together to help your body absorb the natural vitamins and minerals that are in food.
It really is amazing when you just think about like all these things are, just growing on our earth, and then we eat them and they give us exactly what we need for our bodies to function. It's like really cool to see it working.
I know, I totally agree. And that's why sometimes it's not needed for these labs to make food. I feel like everything here, we can grow, we can, even just animals that we raise and that we humanely raised, I should say, that will always provide us what we need, the nutrition that we need compared to boxed foods in the stores. It's crazy to see that other cultures out in the world, people that go around and study worldly cultures and what they eat, when other people and tribes across the world, they eat our processed foods, they start to get cavities, they start to have all these problems and start to get sick. And it's so sad.
Yeah, it is really sad. And that it's like happening here, like in the United States, we are a really developed country, and a lot of our health problems are so related to food, like almost exclusively, you could say.
Definitely. It's all intertwined together. And that's why I always recommend just going back to just an ancestral diet, just what our grandparents used to eat. They used to milk our cows and not pasteurize them. They used to just eat whole foods. And there were so many health issues that are prevalent today that just really weren't as prevalent back in the day. So that's awesome. So many doctors that don't have enough nutrition education at all. They only are required a couple hours worth of nutrition education. What are your thoughts about that?
Yeah, so that's something that makes me so mad. And I'll actually bring up a personal anecdote because my friend the other day, my coworker, she was like complaining. She was like shaky and like felt very faint all the time. And she's a vegetarian and has been for a very long time. And she's like gone to doctors about it. Like they couldn't figure it out. And my friend who's sitting right next to her is also a vegetarian. The first thing she says, she's like, "Are you taking a B12 supplement?" And she's like, "What? No, why do I have to take that?" It's like, because if you're not eating animal products, it's going to be very hard for you to find a source of B12, We encourage her to go out and buy some B12 supplement. And, this is another case, where supplementation is important because if you're lacking a food group, any food from animal products, then you would definitely need B12 because, it's an essential vitamin. Definitely. So, yeah. And I was just very upset because, like, she had gone to doctors and talked to them about it, and they, didn't ever think of that recommendation. So I think medical professionals, not only doctors, but physicians, assistants, nurse practitioners, nurses, like all of them should really have a solid background in nutrition. And when they see certain symptoms, should be able to think, like first, let me ask this person what they're eating. Let me see if they're getting, the proper vitamins they need.
Yes, definitely. And I even heard, I don't remember where I heard this from, but it was a story, he cured cancer just by his diet and food. But one of the things when he was going through the motions of getting tested and all these scans just to see where the cancer was and how far it was spread, after he was leaving the hospital, he's like, "Okay, doc, so I have colon cancer. What should I be doing? Is there something I should not be eating?" And the doctor was just like, "No, just eat whatever you want." And he was like, "So I can have sloppy joes if I want sloppy joes." And he's like, "Yeah, absolutely." Yeah. And I heard that and the inside was just boiling. I was just like, no. Like, it's so sad that there was no education there at all.
Definitely.
So I totally get it.
Yeah, and definitely just changing the culture of food in hospitals because, you have inpatients that are there for days, like weeks at a time, and the food that they're getting is really could be like detrimental, to their health, like it just like another personal anecdote, my friend, she was in the hospital. And unfortunately, she passed away, but they were giving her like soda every single day, and she had cancer. And it's just like crazy that that's what they're getting, and that's actually feeding their illness, So it just seems so contradictory to be treating someone and then giving them bad food.
That makes me so mad. That is why I'm doing what I'm doing. It's so important to take care of your body as much as you possibly can by what you put in it, what you put on it. I mean, everything. I love the whole body approach, but those things, I know. We are going to change that. I promise.
Yeah. We are moving in the right direction. I think people are starting to think about health more holistically and valuing food. So yes. I think it will take a very long time, but I think we are moving in the right direction.
Me too. People are becoming more aware on our food production and just ultimately what we're eating and then how it relates to our health. Awesome. So let people know where they can find you or find where you work.
Definitely. So the Mount Sinai Adolescent Health Center, they do have a website if anyone's interested. It's called teenhealthcare.org. So you can learn a lot about the organization. It is a really great organization, and something I love about it is that it's so interdisciplinary. So our patients can get a lot of different services all at once. Sometimes I wish I could go to the doctor and they would be like, oh, do you want to see a nutritionist while you're here? Or do you want to get your eyes checked while you're here? And so it is a really cool model of healthcare that I think people should learn about, because I think it is like the future of healthcare is doing it in that way.
Absolutely. I will put that link in the show notes as well. Thank you so much for coming on the show today and just empowering us to help our local income communities and having an in-depth look of HPV and the nutrition and all that good stuff. So thank you so much for coming on.
Great. Thanks for having me, Lahana.
Talking with Amira was such a blast. We could talk forever about food and nutrition. I hope you guys enjoyed it. If you are interested in one-on-one consulting or group programs, find us at www.thrivalnutrition.com under the Contact Us section. Also, find us and follow us on Facebook, Instagram, and Twitter. Please leave a review and rating for the podcast before you leave. I love hearing your feedback. I can't wait to see you guys next week. Thanks for tuning in.